Hello, warm greetings from Scotland and New College, Lanarkshire. My name is Pamela McElhinney and I would really like to thank Professor Gamal Shiha and Professor Raifa Alam in including us in this international conference, which will surely be an inspiring 2 days of global exchange of learning and practice. My colleague Lenore spoke to you about some of the amazing work we are doing in Scotland around brain health, and New College Lanarkshire are delighted to be leading on that. In this presentation, there is a shift in focus, and it is in and around nursing in Scotland. As a provider of education and further education in Lanarkshire, New College Lanarkshire have hundreds of nursing students, and we will talk through the ways in which we teach them, but interact with the partners in NHS Scotland, the private and voluntary sector, to make that the best experience possible. So we are really delighted to be here and to be talking, so thank you. I'd like to start with a quick look at the Scottish nursing framework. Within the workforce, the main provider is the National Health Service Scotland, and this accounts for 85% of nursing provision in Scotland. The main regulatory body is the Nursing and Midwifery Council, but depending on the branch of nursing, it can be other regulatory bodies, including the General Dental Council. So I'd like to start by emphasising the importance of this framework. Each of these play a key role in shaping standards, opportunities and expectations of nurses. What ties them all together is a commitment to safe, effective and person-centred care. Within Scotland, once nurses reach what we refer to as level 9 or band 5, the question becomes, what next? That's where continuous professional education comes in. We've seen a huge expansion in learning opportunities, especially through e-learning and the tourist model. And although there's 20 hours of CPD that is mandatory, it's really important to state that it isn't a case of clicking through modules. It's about conversations, reflection, and real engagement with other professionals. Nursing in Scotland, the current scene. We have, unfortunately, seen a bit of a decline in nursing applications, but recent reports from UCAS and the NMC states that that trend is reversing. NMC's latest figures show some drop in nurses leaving the profession, but we are moving in the right direction to fill those gaps and make nursing an attractive profession which people from all branches and backgrounds of life should be attracted to. Importantly for us at New College Lanarkshire, what are we doing and what part are we playing? Our role is really about connection and responsiveness. We listen to the workforce, we sit down with practitioners, we hear what's happening on the ground, and we design learning resources that actually meet needs. Through the Scottish Government, we've been fortunate to receive CLIC funding, which is a fund that allows us to develop accessible, flexible and relevant resources that support real world practice. You might wonder what the most pressing priorities are in Scotland. I've listed some of these, but it's not an exhaustive list. Now, the priorities might look familiar to a lot of the delegates. They're the foundations of safe and effective nursing practice, from biosciences to clinical skills, well-being, leadership, and of course, placement learning. What's important here is that these aren't just topics, they're competencies that support nurses throughout their entire careers. And we need to keep building and refreshing them as practice evolves. In Scotland, there are a number of routes to nursing for young people or for adult learners. This could be from secondary school for students aged 17 and above. There's traditional and non-traditional routes to nursing in Scotland, and that is one of our strengths, that there is no single route into nursing. Learners can come straight from school, through widening access programmes, or through level 5 care programmes, right up until our HNC healthcare practice, where placement is a continuous feature throughout the year. To return to what NHS then do when nurses qualify and throughout the degree, the adult nursing degree, the dental nursing degree, or any other specialism, the main online learning portal is called TURAS. And it is an amazing tool. It gives nurses across Scotland instant access to training. But we have to recognise the limits of e-learning. It is powerful, but it cannot replace every aspect of skill development. That's why blending and blended approaches matter. Combining digital tools with mentorship, discussion, and hands-on practice. When we consult with practitioners, the same requests come up again and again. The well-being of the nursing profession, their mental health, how we can support them to stay in the profession. And that is a challenge, and one that the Royal College of Nursing and the Nursing and Midwifery Council take seriously, along with NHS Scotland. One of the issues in the past in attracting people to nursing is the pay and conditions. In Scotland, thankfully, recently, there has been a huge improvement in this. Furthermore, studying has become more appealing to students. They receive £12,000 a year in bursary, which helps them stay on their degree and reduces the financial barriers that has very commonly been highlighted as the main problem with becoming a nursing professional. So in NCL, what are we doing to make sure that our students feel that it's somewhere they can study? As you can see here, we have a number of campaigns. We have financially fit. We want to make sure that every student who comes to study with us does not face any financial barrier, and that where we encounter that, that we will help them in every way possible. Another campaign we have is Getting to Know You. We know that building relationships with students is the best way to keep them studying with us and continue on the route to professional study at university and with us in some of the degrees that we offer in partnership with other universities. We also have a Be Well to Do Well campaign. I'd like to just discuss now some of the NHS partnerships and programmes that we have already. We regularly have nursing articulation meetings with partner universities to understand the need, the changing nature of nursing and what is involved, and we review our curriculum regularly to meet those needs. One of the examples of this recently is the PDA in acute and in emergency care, which is offered by New College Lanarkshire. And that is upskilling a lot of the clinical support workers in the community to do a lot of the nursing activities so that we have a wider range of people supporting others in the community, as Lynn mentioned in her presentation, that support should not be hospital based alone. We have modern apprenticeships as well, and this allows students to earn while they learn, and they are very popular within the NHS, and it's something that we deliver in partnership with the NHS too. We also have 2 degrees in partnership with University of the West of Scotland. The BSc Collaborative Health and Social Care degree, which is overseen at Motherwell campus by myself, is a pathway to working in health and social care. And even more excitingly is the BSc Dental Nursing, one of its kind in Scotland, where you can become a dental nurse within the college setting and leave with a university endorsed qualification. I'd like to conclude this short presentation, and it's something we could talk for much longer on, by saying that nurses and healthcare workers are the most visible and recognisable symbol of the health service and embody the values people want to see in the NHS in Scotland. Nursing is challenging and the pressures are real, but the work we are all doing, all of us across Scotland and across borders, across the world, is building the future that supports nurses better, develops skills more effectively, and opens doors for more people to join this incredible profession. I'd just like to close by saying thank you so much for listening and for allowing us to be part of this wonderful conference. Thank you.